If you think about the job that we're trying to do for healthcare and for care generally, we always ask ourselves, are we really doing the job, right? Particularly when you have such complex cases with vulnerable populations, Medicaid, Medicare, or Medicaid specifically, and there are a range of needs that these individuals have. How do we ensure that we're doing the job? And what that means is we have to have the partners in the market that are really trying to do it in innovative new ways. And so I'm always asking myself, are we working with the right partners, the people that are really doing the innovations from a workflow and from a care model standpoint that's really going to test us and help us do better as an organization? So often the people that we work with, these populations, have such a vast range of challenges and problems that they face, that for us it's about how do we get focused on kind of the things that both will scale while at the same time really move the needle on the outcomes we all want to see for these populations. There's two components of what we do. There's one component is the technology, which we call the Care Hub, which is really focused on does it facilitate the workflow and the connections, the team structure around these individuals and populations. And that's complemented with a service we call Community Connect. What we're really excited about is we're really building out that Community Connect team that helps these care models that are trying to make those connections in their communities. As you probably have seen from other models, these types of services are highly localized, or kind of hyper-localized. And so enabling organizations that are trying to stamp these models to make those connections is really something we're really excited about. About a year ago, I had a neighbor call me late at night and say, hey, I need your help. We went over to their home. I grabbed a neighbor, went over to their home, and her son had broken into the neighbor's house and was unconscious on her floor, on their floor. And so we had to get this individual to a hospital and admitted into an addiction recovery program. And we started over the next couple months to work through medical health, homelessness, employment, obviously substance abuse and mental health counseling. All these challenges are just so kind of intertwined, and we had to say, how do we connect all these disparate stakeholders that touch a patient like that? So he's part of Mass Health, this is in Massachusetts. How do we take a Mass Health patient that has so many different challenges and help them set priorities and a plan of care that gets a different outcome? If everything's a priority, nothing's a priority. And so you've got to focus on, say, what is the needle we can move on first? And so a lot of these programs will focus on homelessness or employment or food insecurity, and believing that if they tackle that one issue, all the other issues are related and they'll be able to address many of them over time. But it starts by setting meaningful goals with the individual and then trying to work that issue to a different outcome.